consists of three main layers in two distinct regions. The epidermis is a superficial region which consists of epithelial tissue known as stratified squamous. The dermis lies directly beneath the epidermis. It mostly consists of areolar, otherwise known as dense irregular. Below the two distinct regions, there's the third layer known as the hypodermis, which is mainly composed of adipose tissue for shock absorption. It is a subcutaneous layer that anchors skin to the muscles. It changes greatly as it goes through the 45 layers. The stratum corneum is a superficial layer of 20 to 30 rows of dead, flat, anuculate, keratinized, membranous sacs, where its job is protection. Stratum lucidum is a thin translucent band found only in thick skin, a few rows of flat, dead keratinocyte. Stratum granulosum is 4 through 6 cell layers. Cells flatten, nucleus and organelles disintegrate, keratinization begins, and cells above the layer die. Stratum spinosum is many layers thick, is the prickly layer with many dendritic cells. Stratum basale is the deepest layer, firmly attached to the dermis, and is a single layer of stem cells that is actively dividing and pushing to the next layer.
Layers of the dermis are the papillary layer and the reticular layer. The papillary layer is made up of regular connective tissue along with collagen and elastic fibers. The reticular layer is made up of irregular dense connective tissue and also contains elastic and collagen fibers. Dermal papillae are superficial peg-like projections that stick into the epidermis above them. They are located in your thick skin, which is found in your palms, fingertips, and the soles of your feet. Dermal papillae lie on top of dermal ridges in your thick skin, which cause friction ridges. Friction ridges have multiple functions, including enhancing your gripping ability, contributing to your sense of touch, and forming the pattern of your fingerprints. Blisters are fluid-filled pockets that separate your epidermal and dermal layers. They are from acute, short-term trauma such as heat or friction. Flexure lines are dermal folds that form near or at the joints. The function of these flexure lines is to keep the dermis tightly secured to the deeper structures of your skin, so the skin does not easily slide when joints move. They are found in your hands, wrists, fingers, soles, and toes.
The three main pigments of the skin are melanin, keratin, and hemoglobin. Melanin is produced in melanocytes. Melanin pigment is found in skin, hair, and eyes. Sun exposure stimulates the melanin production, which is a reddish, yellowish, brownish black. Keratin is found in stratum corneum and hypodermis. It is yellow and orange, and for epidermal health as well as vision, it can be converted to vitamin A. You can receive keratin through foods. Hemoglobin is present in red blood cells of the dermal layer. It has a pinkish hue and is produced in bone marrow. All skin has keratinocytes, melanocytes, and three basic skin layers, but it can differentiate by the amount and type of melanin, distribution of melanin in response to UV radiation.
Cyanosis is when the skin turns a bluish color, and this is caused by low oxygenation of the blood. This can be a sign of heart failure or choking. Jaundice is when the skin takes on a yellow cast and can be a sign of liver disorder. Pallor is when the skin goes pale or blanches and can be a sign of fear, low blood pressure, or anemia.
Hair is located on all parts of the body except palms, parts of the external genitalia, soles, nipples, and lips. It helps warn us if insects have landed on us. It protects the head from sun, heat loss, and protects against force such physical trauma. Eyelashes and nose hairs help with filtration. The shape and structure of the hair follicle and hair shaft can explain the different textures in hair. The layers include the cuticle, which is the outermost layer. The function is to prevent hair from mating.
Hair follicle is the part of your skin that is responsible for growing your hair. The hair bulb is the living part of the hair that has sensory nerve endings and allows you to tell when your hair is being touched. The hair matrix is where your hair cells actively divide, pushing up older cells. The hair papilla supplies blood for your hair and signals growth. The erector pillae muscle are responsible for goosebumps when you are cold or scared by contracting the muscle attached to the follicle. The two types of hair are vellus and terminal. Vellus hair is pale, fine body hair, and terminal hair is coarse, long hair, and it's found in your long hairs, eyebrows, and pubic regions at puberty. Your nails serve as a protection of the soft distal and dorsal surfaces of our fingers and toes. Your nail bed is the deep layer beneath your nail. The nail matrix is responsible for nail growth. The lunula is the thick white crescent over the nail matrix that protects this matrix. Nail folds cover the proximal and lateral edges of the nail. Glands or sudoriferous glands are on all parts of the skin except the nipples and external genitalia. The two main types of sweat glands are eccrine and apocrine. Eccrine sweat glands are found in the palms, soles, and forehead. They are essential for thermoregulation. Apocrine sweat glands are located in the axillary and anogenital area. Their function is unknown, but they may act as a sexual scent gland. Sebaceous glands are found all over the body and in large amounts on the face, neck, and chest. Sebaceous glands secrete into hair follicles and are inactive until puberty, and they secrete sebum. Acne is the inflammation of a gland forming a pimple on the surface of the skin from bacteria.
Three functions of the integumentary system include excretion through sweat, the body gets rid of waste, continuous sensation, which is touch and pain receptors, and body temp regulation, where your body is more comfortable and able to work best in a specific temperature range. Insensible perspiration is continuous and not easily detected, occurs when the environment is lower than 88 through 90 degrees Fahrenheit, and we set around 500 milliliters a day through this. Our dermal vessels widen and sensible perspiration occurs when the temperature increases to cool your body down during the day. When I am dancing, my blood vessels dilate and sensible perspiration occurs because my body is hotter than normal and needs to cool off.
The risk factors of getting skin cancer are overexposure to UV radiation and frequent skin irritation. The three main types of skin cancer are basal cell carcinoma, which represents as a shiny dome that develops into a central ulcer. It is found in the stratum basale layer, and it's normally cured by surgical excision. Squamous cell carcinoma appears scaly and red, is found in the stratum spinosum, and can be treated by radiation therapy or surgically removed. Melanoma appears dark and irregularly shaped, is found in the melanocytes, and requires wide surgical excision along with immunotherapy to cure it. The ABCD rule is helpful with early detection of melanoma. It can provide people with a guide to recognize early symptoms of melanoma, such as asymmetry, border irregularity, color, and diameter. First-degree burns are the least severe and have damage only to the epidermal layer. Second-degree burns have damage to the epidermal and upper dermal skin. The third-degree burns are the entire thickness of the skin, and these can be life-threatening. It is used to determine the estimated volume of fluid loss by breaking the body up into 11 different areas, each taking up 9% of the body.